Hello, I'm Dr. Harshal Ingle. I'm Interventional Cardiologist working at Ruby Hall Clinic Pune. So today we are going to discuss about hypertension. As we all know that hypertension is a big problem worldwide. Almost 30 to 40% of world population is suffering from high blood pressure. The main issue with blood pressure is that we haven't done a very good job. Complications associated with it, like it may cause stroke, heart attack, heart failure, even arrhythmias in some cases. So one big problem with hypertension is that almost 30 to 40% are undiagnosed or they're not taking the drugs as prescribed by the physician. Many patients who are on medications are classified into resistant hypertension as well. So because of this, there are many complications which are occurring in hypertensive patients. Some patients even lands into resistant hypertension. Now, which patients are called as resistant hypertension? See, many patients are at least on 2 or 3 drugs, but if these drugs exceed beyond 4 or 5 drugs and still their blood pressure is not controlled, these patients are labeled into resistant hypertension. Now, what can we do for this patient? See, there are some newer therapies which are available in the market and recently came. One of this is the renal denervation therapy. So what is renal denervation? This is a novel therapy which has recently been introduced in India, which was earlier available in foreign countries. Now, what we do in this procedure, normally the blood pressure is controlled by 3 organs, the brain, the kidneys and the heart. These all 3 organs connect each other, or what we call that they talk to each other with the help of these nerves. Brain sends the signals to the heart and to the kidneys. So kidney is the one which modulates or keeps the control of blood pressure. In patients with hypertension or patients who are resistant hypertension, especially who have a very high blood pressure, who are on at least 6 medicines and blood pressure is not controlled, in these patients, the kidney nerves, those are overactive. So it's the same procedure, just like coronary angiogram. We go through the right groin, we take the renal catheters, we engage it into the renal arteries and we take the renal angiogram. Why we take renal angiogram? Because the nerves which are supplying or which control the blood pressure, they are surrounding these renal arteries. So what we do is we take the pictures, we identify the arteries which are larger, which are mostly bigger than 3 millimeters. And after identifying this, we take a catheter, which with the help of this catheter, we engage, we go into the renal artery, and with the help of radio frequency ablation, or what we, in simple terms, we heat the nerves and we burn that part. So to make this overactive nerves a little less active. So in this way, we control the blood pressure in these patients. So recently we have done a case of a 55-year-old male who was on 4 to 5 medicines of hypertension. Still, his blood pressure was not controlled. Recently, he had some complications related to hypertension. So we advised this novel therapy to this patient. After detailed discussion, he was ready to undergo this procedure. He was taking 6 medicines. Despite his medicines, his blood pressure was in the range of 220, which was systolic, and around 130 diastolic blood pressure. This was the first case done in Ruby Hall Clinic Pune. He underwent this therapy. There was only 3 days of stay required. After 3 days, he was completely discharged. After 3 days, his blood pressure medicines were completely stopped. On 15-day follow-up, his blood pressures were medicines were completely stopped. Now his current blood pressure is just 128/70 and he is having no complaints regarding this therapy as well. So this was the first successful case done in Ruby Hall. Patient is doing fine. His blood pressure medicines have completely stopped. Patient is happy. He is not having any complaints. So from this, we can conclude that this is the best therapy available, especially in patients who are landing into resistant hypertension case, who are on almost 6 to 7 medicines. Still, their blood pressure is not controlled. So this is a recent novel innovative therapy which has recently came in India, and almost every patient with resistant hypertension should undergo this therapy. So this is a new bright future for patients in resistant hypertension, and almost if any patient who are in resistant hypertension who are almost taking 6 or 7 medicines daily for hypertension should undergo this therapy for a better outcome of life.